Okay, so myth buster number two, this one's a little bit trickier, and that is, how stable is my LASIK once I have LASIK? And do I always have to keep on having LASIK, or will my vision stay the same after LASIK? And the answer is LASIK is very, very stable after your first procedure. Enhancements are a big part of LASIK. In our practice, we have to enhance less than 5% of our patients. But what people don't understand about LASIK enhancements is that what an enhancement really represents is the fact that your original LASIK procedure really didn't get you all the way to the final destination that we were trying to get you at the very first time that you went under the laser. And the truth to that is that that's something that's very easy for us to identify within the first month or so after your surgery. So in our practice, which is no different than most good practices, the vast majority of our patients, we know that they're headed for an enhancement in one eye within the first month after their surgery. So most patients that require enhancement after LASIK, their enhancement is going to be done within the first 3 to 4 months after their original surgery. What doesn't happen typically is that patients have successful LASIK at almost any age, in their 20s or their 30s, and then they magically somehow down the road, 3 years or 5 years or 8 years, come in and they need to have LASIK again. That's called regression. That can happen, and that's more common when someone's prescription is really big. But even when someone's starting prescription was even larger than what we normally try to achieve today, Tiger Woods would be a great example. Tiger Woods was 10 diopters nearsighted. So those of you who wear contacts and see on your box, Tiger Woods' contacts when he was in college was minus 10.0, which is a very large correction. Tiger Woods had LASIK once when he was 21 years old, 20, and he's never had an enhancement. So that would be a great example of the stability of LASIK for your distance vision. What also causes confusion is that we all eventually lose our near vision. So many LASIK patients have LASIK in their 20s and their 30s, and then in their early to mid 40s, they start to struggle. For the first time, they need reading glasses, and their first thought is that their LASIK has worn off. But that's not your LASIK that wore off. That's you collecting birthdays and eventually running out of steam with your near vision, and unfortunately that affects everybody, including me.